Hello everyone, Dr. Waye Smith here at Family Chiropractic in Stettler. Today I want to talk to you a little bit about your lower back. First I want to share some anatomy with you. So we have two vertebrae here, first of all. You'll notice that there's two joints in the back which connect those two vertebrae and a disc in the front. You'll also notice a spinal cord going down the back with nerve roots in yellow coming out between each segment. Now, the thing that we want to pay attention to is anytime you get inflammation or swelling that goes either forward from the joints or backward from the disc and irritates those nerves, that's what gives you the pain and the problems. Now, pretty much everybody has had low back pain at some point in their lives, and a major cause of that is actually improper lifting techniques. And it's not necessarily how much you're lifting, but exactly the way that you're lifting. Improper technique can cause a lot of problems for you. So there's just two simple tips that I'm going to share with you today. The first is about the movements that you do while you're lifting. Now, it's okay to bend. Of course, you're going to have to bend your spine if you're going to lift something up, and it's okay to twist. But doing those two motions together at the same time, bending and twisting, especially with a load that you're trying to carry, is extremely hazardous to your spinal health. Bending alone will cause a certain amount of compressive force. Twisting alone will also cause a certain amount of compressive force. But those two actions together in biomechanical studies that have been done create an exponentially more amount of strain on those tissues in the low back. So bend or twist, but don't do both at the same time. The second is a technique that is well known to weightlifters and powerlifters, but not so much to the general public. And that's when, before you begin to lift an object, you actually tighten up the core muscles in your lower back to help stabilize that area. And I can show you a demonstration that will illustrate this point. Here I have an empty pop can. And if you can imagine that this is your spine and you have not compressed any of those or tightened any of those core muscles in your lower back, it's very easy to actually compress this can, especially if the forces come a little bit of an angle or to the side. That's the kind of thing that's happening to your low back. By contrast, if we have a full can of pop, the metal is the same, everything is the same about it, except there is internal pressure because of the pop and the gases that are inside this. This creates a much more stable surface that the pressure cannot act upon as strongly. So it takes a great deal more force to cause any damage to this can than to the empty can. So in the case of your low back, if you can tighten those core muscles a little bit before you begin the lifting procedure, it'll help a lot to reduce the injury. Thanks for watching. I'm Dr. Waye Smith at Family Chiropractic.